Hello, my dear students of EMC 14. Hope all of you are fine along with your family members. Today, I will discuss primary healthcare. Primary healthcare is a very important topic, and some of you requested to present these topics. Objectives. At the end of the session, we will able to know background of primary healthcare, definition of primary healthcare, elements of primary healthcare, principle of primary healthcare, strategy of primary healthcare, then levels of primary healthcare, existing facilities of primary healthcare in our country, that is in Bangladesh. Let's we discuss one by one to achieve the objective. Primary healthcare background. All of you know the background, but in case of examination, you cannot write it very concisely. This is why I concise the background and try to present before you, so that in the examination you cannot feel any problem to write the answer. What to mean by the background of primary healthcare, or state the primary healthcare, write the background of primary healthcare. It has some relation with the changing concept of public health. Changing concept of public health are disease control phase, then health promotional phase, social engineering phase. During the application of social engineering phase, the conscious people of the world observe a change, a clear discrimination. Health for all by the year 2000 AD, which is the outcome of primary healthcare. Now, at the end of social engineering phase, it was recognized increasingly the failure of existing health services to provide healthcare. Then an alternative idea and method to provide healthcare have been considered and tried. That is, people who are thinking about the public health, they recognize that the existing healthcare delivery system fails to fulfill the demand of the citizen as a whole. Only it satisfies a class of the people, and a good number of people deprived from this type of healthcare delivery system. So we need a new healthcare delivery system. Desired alternative idea and method were approved at a joint WHO-UNICEF International Conference in 1978 at Alma-Ata. Alma-Ata is a kingdom and is a state at the then USSR, where the government of 134 countries and many voluntary agencies decided to undertake a revolutionary approach to improve the healthcare of their countries. They all are decided to take a appropriate decision so that all the people of their country benefited from this healthcare system. Declaring the existing gross inequality in the health status of the people, particularly between developed and developing countries. East and West. East and West means the Western country are developed and most of the Eastern country are developing and underdeveloped. Poor and rich of the same country, urban and rural, literate and illiterate, health for all by the year 2000 AD, adopting the strategy of primary healthcare. That is, primary healthcare is a healthcare delivery system which is approved by Alma-Ata Declaration in presence of 134 representatives from 134 countries. The main idea is to provide uniform healthcare services to all the people of all countries. Now, definition. It is something unpleasant, this definition, but still there is no alternative other than to read it. Essential healthcare based on practical, scientifically sound and socially acceptable methods and technology, then made universally accessible to individual and families in the community through their full participation and at a cost that the community and country can afford to maintain at every stage of their development in the spirit of self-determination. I think it need not any clarification, but it is something clumsy. So there is an alternative definition which is also appropriate for your examination, but for carrying distinct number, you should answer this definition. Then another definition, essential healthcare made universal, accessible to individual and acceptable to them through their full participation and at a cost that the community and country can afford. This is the short definition. It is also we accept in the examination for the pass, but not for the good number. Now, elements of primary healthcare. There are 8 elements of primary healthcare. Number 1, education concerning prevailing health problem and the method of preventing and controlling them. Number 2, promotion of food supply and proper nutrition, and adequate supply of safe water and proper sanitation. Maternal and child health care, including family planning, immunization against major infection diseases, then prevention and control of locally endemic diseases, appropriate treatment of common disease and injury, and last of all, 8th element, provision of essential drugs. Provision of essential drugs. Principle of primary health care. There are 4 principles. Number 1 and most important principle is the equitable distribution. It is frequently asked in the examination, what is the difference between equitable distribution and equal distribution? Equitable distribution means distribution in relation to the need of the population. In the need of the population, are equal distribution equally distributed to whole population. Are equitable distribution on the sense of need. The first key principle in the primary healthcare strategy is equitable distribution of health services. Health services must be shared equally by all people, irrespective of their ability to pay, and all, that is rich or poor, urban or rural, must have access to health service, which is now distributed to the cities only. Primary healthcare aims to redistribute this imbalance by shifting the center of gravity of the healthcare system from cities to the rural areas and bring these services as near people's home as possible. That is, equitable distribution means distribution of the healthcare services on the basis of the need of the people, on the basis of the need of the people. Then 2, community participation. Another important principle is the community participation. Involvement of individuals, families, and communities. Promotion of their own health and welfare is an essential ingredient of primary health care. Countries are now conscious of the fact that universal coverage by primary health care cannot be achieved without the involvement of the local community. There must be a continuous effort to secure meaningful involvement of the community, the planning, implementation, and maintenance of health services, besides maximum reliance on local resources such as manpower, money, and material. In short, primary health care must be built on the principle of community participation, that is the community involvement. In the examination, frequently it is asked, give some example of community participation. Now our EPI program, our TB control program, these all are good example of community participation. Principle of primary healthcare continued. Then intersectoral coordination. There is an increasing realization of the fact that the components of primary healthcare cannot be provided by the health sector alone. It is not possible by the health sector alone to provide all the things to the people. From the definition of the health, without proper nutrition, nobody is healthy, and the nutrition is maintained by other sector. The ingredient of the nutrition is from poultry, fishery, agriculture, and other sector. And the equipment of treatment facilities is also maintained and invented by other sectors like engineering sector, public health engineering, like this. Intersectoral coordination. The declaration of Alma-Ata states primary healthcare involves, in addition to health sector, all related sectors and aspects of national and community development, in particular agriculture, animal husbandry, food industry, education, housing, public work, communication, and other sectors. Now, the last principle is the appropriate technology. Technology is scientifically sound, appropriate to fulfill the need, and acceptable to those who apply it and those for whom it is used, and that can be maintained by the people themselves in keeping with the principle of self-reliance with the resources the community and country can afford. That is, if we import some technology from the developed world and our people cannot accept it, then it will play no role in the improvement of the health of our people. So technology should be appropriate. Implementation strategy of primary health care. In our country, we select some strategic point for the proper implementation of the primary health care in our country. These are social control through their full involvement, political commitment at all levels. Without political commitment, it is not possible to achieve the goal of the primary health care. Support of professional bodies, human resource development, technical support through operational research, resource mobilization, and monitoring and evaluation. These are the strategic points for implementation of primary healthcare activities in Bangladesh. Now, levels of primary healthcare. These are another important primary level, secondary level, tertiary level. Primary healthcare divides the healthcare delivery system into 3 levels: primary level, secondary level, and tertiary level. And there is a good relationship between primary, secondary, and tertiary. From the primary level, the patient who needs treatment from the secondary level, they refer to its secondary level, and from the secondary level, if patient need treatment from the tertiary level, then they refer to tertiary level. But in fact, in reality, it is our tragedy, we cannot yet able to apply the rules of referral system which is mentioned in primary healthcare. Now, primary level. Primary level starts from community clinic. Every 6,000 population covered by one community clinic. Then USC, Union Subcenter, FWC, Family Welfare Center, Health and Family Welfare Center. Approximately 27,000 population is covered by one Union Subcenter like this. Then Upazila Health Complex, approximately 270,000 population is covered by one Upazila Health Complex. And these three infrastructure completed the primary level healthcare. Now the secondary level, district hospital, maternal and child welfare clinic. Then tertiary level hospital, medical college hospital, postgraduate specialized hospital. So these are the 3 levels of primary healthcare, that is primary level, secondary level, and tertiary level. Now, the magnitude of the infrastructure in each level. Now, in our country, we have 36 government medical college hospital and 59 private medical college hospital. These are tertiary level healthcare in Bangladesh. Then 10 postgraduate institute and hospital, 9 dental college and hospital, 20 specialized hospital, 1 homeopathic medical college hospital, and 1 ayurvedic medical college hospital. These are the magnitude of the tertiary level healthcare in Bangladesh. Now, secondary level district hospital 59 in number, maternal and child welfare center MCWC 60 in number. It is 59 and it is 60, almost equal, one different. The services given there: outdoor service, indoor service with laboratory, radiographic and ambulance service, or maternal child, EOC and other related service. These centers are particularly promote the maternal healthcare and infant healthcare. Maternal is under 5 children and maternal healthcare. Now, in primary healthcare, community clinic, the number of community clinic is 13,861. The services given: family planning, MCH, immunization, communicable disease control, treatment of common problem, and referral to the secondary and tertiary level. These are very important, frequently asked in the examination. What are the services rendered at the community clinic level? Now, Union Health and Family Welfare Center, the number is 4,300. Outpatient service, family planning, MCH, communicable disease control, clinical care, normal delivery, and adolescent health care. Upazila Health Complex 424 is completed yet. Outpatient service, inpatient service, then with diagnostic and operative treatment in some institute. Services of community clinic. Service level, primary level, service time 9 AM to 3 PM. Service provider, community healthcare provider, CHCP, health assistant, family welfare assistant. Available services, maternal and neonatal healthcare services, integrated management of childhood illness, IMCI, reproductive health and family planning service, EPI service, nutritional education and micronutrient supplement, then health education and counseling, then screening of chronic non-communicable disease, treatment of minor ailment, common disease, and first aid. These are the services rendered from community clinic. Concept of community clinic, it is a good example for public-private relationship. Till date, 13,861 government has planned to increase it up to 18,000. Activities, land for CC construction, community. Land will be dominated by community people. Then construction, government. Government will construct the infrastructure. Medicine and other input by government. Service provider by government. Management, community group plus GOB. That is public-private partnership. Community group, CG, and community support group, CHG, are the key player for the maintenance of a community clinic. Now, the summary. Shortage of manpower, particularly in the public sector. Public means government sector. In 2015, there were 0.47 physician per thousand population, compared with 0.76 for India and 0.98 for Pakistan. There is also a serious shortage of nurses, particularly in state hospital, means government hospital, resulting in an inappropriate skill mix. The ratio in 2015 was 1 nurse for every 3 doctors. It is very, sorry to say, it is not a good ratio. Now, thank you all, and this is the end of my today's presentation from primary healthcare.